Today we will share some shocking news about a 58-year-old woman and the distress that has caused her family and herself when a doctor told her she had a rare and terminal cancer. You never know when life will throw you a curveball. It has the potential to completely derail all of your plans and turn your world upside down. We get chills when we hear the word cancer, and if it's terminal, we can only hope for a miracle. Have you heard that your itchy hand could be a symptom of a type of cancer that can't be treated? Maria Alessandra Barry, 58, from Harrow, northwest London, got a terrible blow when she discovered that her itchy hands were actually a sign of rare and terminal cancer. Let's understand what terminal cancer is. Terminal cancer refers to an untreatable or incurable cancer. Some even call it end-stage or last-stage cancer. Any cancer can progress to a fatal stage. At this point, death is inevitable. Terminal cancer is usually unresponsive to treatment. As a result, treatment focuses on providing as much comfort as possible. Now, let's look into how it all started with Maria. Maria's problems began when her hands began to itch incessantly. She stated,
I had gallstones a few years ago and had my gallbladder removed, but prior to that, I had never experienced any health issues.
Furthermore, she lamented,
During the lockdown, I had cracked hands and was required to wear gloves. At first, I blamed it on a reaction to a new cleaning product that I'd recently purchased to clean the cooker. They were extremely itchy, and I was having aches and pains in my elbows, joints, and everywhere else.
Due to the lockdown, Maria was unable to get a face-to-face visit with a doctor. So she sent photographs of her swollen and painful palms to the clinic. She was administered numerous steroid creams, gels, and UV treatments through the course of the following year, but to no avail. The trauma Maria's family faced is heartbreaking. She resided in Harrow with her 3 children, Nico, 32, Luca, 30, and Nadia, 27, and states that her intuition was loud enough. There was something more to her itchy skin. She stated,
I sensed something was amiss. Nothing had worked after months of trying alternative methods. I insisted on a CT scan, assuming that something was gravely wrong.
On Christmas Eve 2021, Maria was summoned to Northwick Park Hospital to receive her test results. Fearing the worst, she brought her children, Nico, who was unemployed, Luca, a salesperson, and Nadia, the manager of a football center, for support. She stated,
The news has absolutely stunned me. The physicians suspected I had a rare form of cancer and recommended a biopsy.
Nadia, the youngest of the 3, opened up about her mother's condition.
During the agonizingly long and arduous wait, we performed our own research on the malignancy and discovered that a trial was being conducted at UCLH Hospital to compare the efficacy of gene therapy versus conventional chemo in treating people with this type of cancer. My mother underwent a biopsy and was informed that the prospect of locating the defective gene would be investigated. Meanwhile, the conventional chemotherapy treatment began. Mom can't handle the chemo and is having terrible side effects. In fact, the side effects are so bad that doctors have put her on chemo rest. But this rare and aggressive cancer is so stubborn and unpredictable that the prognosis is now even worse, with only 3 to 6 months to live.
Nadia said that although the UCLH hospital has confirmed that they have discovered the damaged gene and are likely able to provide gene therapy, a gentler method of treatment on the body that attacks cancer with the same ferocity as chemotherapy, is not covered by the NHS. Nadia added.
My siblings and I haven't even had children, and we haven't even moved out yet, and she's already crying and saying she doesn't want to die. It appears as if the physicians have abandoned her. I'm a realist, so I'm not claiming that the study would heal her, but if it adds even 5 years, it's worth every penny. Because my mother is continually feeling ill and can't even enjoy her remaining time due to chemo side effects. I'm desperate for gene therapy.
You can help the family by donating to Maria's GoFundMe page. The link is added in the description below. Can you just imagine how shocking it was for the family when this devastating news was delivered? On Christmas Eve, the physicians broke the news to her that they had a strong suspicion that she had a highly uncommon kind of cancer and required a biopsy. Her first 3 biopsies had produced inconclusive results. After a 4th biopsy, they were certain that Maria's condition was deadly. Because it was so uncommon, the doctors explained that they needed to conduct additional tests to determine what kind of cancer it was. In April, she was diagnosed with cancer of the bile duct. In addition to that, it had spread to her liver.
The doctors confirmed that I had a 9-centimeter lump that was known as intrahepatic cholangiocarcinoma, and I was offered chemotherapy that began in May. The treatment has been going well so far, with the hope of getting cured soon.
So what does medical science have to say about Maria's diagnosis? Her extremely rare form of bile duct cancer has almost no treatment options, and the National Health Service in the UK does not provide coverage. This form of cancer affects the ducts in the digestive tract that convey bile, a digestive fluid required to break down lipids, and connects the organs in the digestive tract. One of Maria's symptoms was that her hands were dry and itchy. Other warning indicators were yellowing of the skin or the whites of the eyes, jaundice, black urine, paler feces than usual, and fatigue. Cancer is more likely to be curable through surgical removal when detected in its earlier stages. In Maria's case, it had already spread to her liver before being discovered. The big question is, are there any treatments for this kind of terminal cancer? In most cases, treatment options for terminal cancer are measures that reduce any discomfort from the harmful effects of cancer and any treatments that may be causing painful side effects. Some physicians may still administer chemotherapy and radiation in an effort to increase a patient's life expectancy. However, this is not always a viable treatment choice. Let's see what oncologists have to say. Although oncologists have some say in the treatment plan for patients with terminal cancer, in many cases the decision comes down to the patient's preferences. Some people with terminal cancer forego further therapy due to its undesirable side effects. Some, for instance, may conclude that the potential increase in life expectancy conferred by radiation therapy or chemotherapy is not worth the probable adverse consequences of either treatment. Although it is highly unlikely that the medicines tested in these trials would be able to cure terminal cancer, the knowledge gained from them helps the medical community understand how to treat the disease better. They have the potential to be of use to following generations. This is a strong approach for someone to ensure that their final days have an impact after they have passed. But are there alternative medical procedures that may act as a momentary rest? Alternative medicines have the potential to be helpful for cancer patients in their later stages. Acupuncture, massage therapy, and other relaxation treatments can assist in easing pain and discomfort, and there is a possibility that they can also help reduce stress. Many medical professionals recommend that patients dealing with terminal cancer See a psychologist or psychiatrist for assistance in coping with feelings of anxiety and depression. If you notice that your hands or palms, or even your feet or upper body parts are itchy, you should not dismiss this symptom as something unimportant. It is possible that you may have to face the darkest nightmare of your life because of it. Receiving treatment for terminal illness in its earlier stages of the disease's progression is almost always more beneficial than receiving treatment at a later stage. Let us all make an effort to maintain our health and hope for a life free of disease and illness. Check out What Your Skin Says About Your Health, or Early Skin Cancer Signs You Must Watch Out For. Go ahead, click one, or better yet, watch both, and learn more about being vigilant and careful with certain signs and symptoms that your body sends you. Have you considered being more conscious of any associated changes in yourself after watching this video? Let us know in the comments section below.